Welcome, everyone, to the Gupta Klinsky India Institute GKII's presentation event for our scholars for our Girish and Himangi Rishi Student Travel Awards program. So excited to have you join us today for our first event. Wanted to give you a brief overview of the agenda today, which will be welcome remarks from our Executive Director, Kunal. I'll go over some highlights of the program, and then we'll hear some on-the-ground testimonials and perspectives from our faculty mentor, Dr. Anita Shett. And then we'll get into the student presentations. They're excited to share their experiences and some updates on their work. The way that we're going to run this session here is that the event is going to be recorded, so everybody will receive the recording. We'll publish that out on our website and our communications channels, along with some of the materials. For accessibility purposes, you all know that you can set your settings so you can have captions on Zoom or on YouTube if you're watching this on the recording. And we're asking that the participants please mute your microphones during the presentations, and you can post any questions that you have in the chat. If you want to just post those, we'll get to those at the end, or we'll have some live Q&A at the end. And if you're reviewing this recording later, feel free to email the team at jhii@jh.edu with any questions. All right, so we'll give you a quick overview of our institute, and I'm going to hand it over to our Executive Director, Kunal Pal.
Thank you, Beth, and thanks all for joining. We appreciate you making time this afternoon. I'll try and be brief just to make sure we give enough time to our fantastic students who are here with us today. As you may know, Hopkins has been working in India for almost a century, driving some really large, impressive, impactful projects. And about 5 years ago, the university decided to set up the India Institute as a central unit to coordinate and supercharge Hopkins' work in India. At last count, we had something like 170 faculty members working in India. And a range of schools and disciplines. And our goal is to coordinate that work, supercharge that work, and drive some large initiatives of our own. We have four areas of focus for us as an institute. Research, obviously this is bread and butter for us as a university, and it's very important that we create research partnerships and research impact for faculty, both here at Hopkins and partner institutions in India. We do a lot of work in policy and practice to help translate this research into impact on the ground. And a lot of our efforts are focused on community engagement, communications to ensure that the work is amplified and reaps further impact. But a very important section of what we do focuses on education and training. This is to create opportunities for Hopkins students and faculty in relation to India, but also our partners and students in India to engage with Hopkins. And this program very much sits in this domain. And this program is the GKII Girish and Himangi Rishi Student Travel Awards, as Beth has mentioned. The primary purpose is to empower, JHU master's students to conduct impactful research and experiential learning opportunities in India. And certainly this benefits the students, we'll hear from them. But we also think this benefits faculty members who are recipients of the students' support and help to work on critical research projects. We will also hear from a faculty member today who's been a recipient of a fellow and hosted a fellow. But ultimately, the goal is to impact the community with the joint efforts of the faculty and the students. And all of this is supported through this program. In terms of logistics, what this program truly supports is grant funding to support travel to enable on-the-ground experiential learning and research work for these fellows on the ground. And in terms of impact, we are really looking at some very critical issues, as you'll see, wide-ranging critical issues. We want these to have a global reach and to foster collaborations, particularly between the US and India. And we want them to be ambitious projects that hopefully will be long-term and sustainable. And again, I hope you'll see that in our very, very excellent awardees. The last thing I'll say is a very quick but a large thank you to our donors and supporters of this program, Mr. Girish Rishi and Ms. Himangi Rishi, both of whom are very, very kindly with us today. Girish is an alumnus, a proud alumnus, if I can say so, of SAIS, accomplished tech executive, and amongst other things, he's very passionate about business technology and solving very critical large-scale issues in India, including those related to urban hunger, sustainable diets, and health inequity. And Himangi Rishi, ma'am, very, very interested, as we understand, in maternal health, child health, through better access of food and nutrition. We also want to acknowledge our partner, the Center for Global Health, who help with a lot of logistics in the support of the placement of these students. So with that quick introduction, I'll hand back over to Beth.
Thank you, Kunal. That was a great framing for GKI and the overview of where this program sits in our verticals. I am the program manager who focuses on the educational initiatives for the Institute. Very privileged to be able to do that because it is my passion. So this is one of the programs I was able to embrace and take on, and it is a 3-year program, as Kunal mentioned, supported by our donors, very generously supporting some of these travel awards. In these 3 years coming up this year, we'll be announcing our awardees very soon. We will have impacted 22 students, faculty, and Indian partners. The projects you'll see today are very specialized, but we will have a summary of all of our program partners and all of the projects that have been worked on over the years in the materials that you'll receive later. I was really excited to be able to learn more about this program, the opportunities, because it really does have the ideal experiential model. From an academic standpoint, when I joined, I was able to align this program to some very tangible and deliverable student learning objectives that also meet the institutional standards for experiential learning and co-curricular experiences at JHU. And when we actually implemented new aspects of this program, including student resources, materials, we have a program report and evaluation and templates that we really encourage the students to be reflecting on their learning experience, self-reflecting. And a lot of the evaluations come out to say that our learning objectives are being met. And that's the result of the faculty mentors' dedication, the India partners that are involved, the donors supporting this experience. And the student interest, they're really, really just amazing to be able to travel to India, encountering all of these new experiences. And it not only expands their global research skills, but what I really love to read and see is the collaboration, the cross-cultural competence that they're learning, the clarity in career goals, and the personal growth and discovery. And all of the students that have participated have really, this is a word cloud of the experiences that they've said that they've had going to India under this program. And resiliency stands out, mentorship, self-awareness, all of these things are being cultivated just through this one program. So I'm really excited to bring that to life today. And that's what I love to see as an educator from any program that we offer. And like I said before, a lot of this is implemented and facilitated by our JHU faculty that are really, leading these projects in India, and they embrace and offer these opportunities for students to come and work with them in the field. And that's an amazing, prospect. And I think that the more faculty that are supported to be able to do this, the better, to be able to grow and expand our program as well as make it sustainable for our India partners. So Dr. Anita Shet is a faculty member and a mentor that I've been privileged to be able to get to know a little bit in some other programs, and this one as well. She leads one of the placement sites, as well as more than one actually, with our India partners, and she's been building these mutually beneficial relationships on the ground. So I'd love for her to kind of share some of her faculty perspectives. She really inspires and provides a lot of mentorship and support to these students along the way over the past decade. So Dr. Anita, I would love for you to talk a little bit more about your perspective as a faculty mentor.
Great. Thank you, Beth. And I really want to echo the sentiments that both Kunal and Beth have expressed. We're really grateful to you, Girish and Himangi, for this generosity and the insight that you had in establishing this program. So collectively, I just want to describe this program in 3 words. So transformative, community rooted and sustainable. And I'll just spend a minute on each of these with examples. So on the picture here, you see a picture of girls and young women who participated in a gender camp that was organized by Autumn Tangiani. So she's one of the students who was the recipient of this award. So what's remarkable is that she had this idea and she conducted this camp not during the period of scholarship. She spent the 4 months in India, completely immersed with the community. But after she completed and came back to Hopkins, finished up her coursework, and just before graduation, we found additional funding because the community really wanted her back to organize this gender camp. So that's what happened. So anyway, you can see the joy in the faces of these young women. Many of them they've lost their parents born with HIV or affected by HIV, and many of them are venturing outside their village into the city for the first time, and it was pretty transformative for them. In the next slide, we can go over those 3 concepts that I mentioned. So overall, it's an immersive experience, as I said, but it's also unique because it departs from this, traditional top-down approach that we have for health intervention, often imposing outside solutions on communities. But instead, these programs teach students to embrace a decolonized approach, and it sort of centers equity, humility, and mutual learning. So here in the picture, we have Casey Fillion, who's another student, a recipient of this award, who went back to India multiple times after her first placement and really engaged with the community, worked on the curriculum to improve their physical fitness and their overall health. But it was taking leaves out of the community themselves and engaging them completely and transforming their lives. The next point is that the program is community rooted and community centered, because at the core of this overall experience for students and faculty is this authentic community engagement with incorporation of community-based participatory research, where those with lived experience of anything that we're working on in public health are involved in every stage of the research process. So the students who go and work at these sites as part of this program, they're not just mere observers or learners, they're actually collaborators in the daily rhythms of the community because they live with the community and engage with them deeply. So there's this emphasis on trust and co-design and coming up with contextual solutions that overall benefits and empowers the local community where the research is conducted. And finally, sustainability is another defining pillar of everything that we do. Especially in today's landscape, where the external funding is increasingly unstable and maybe short-term, our program encourages students to explore models that promote long-term impact from within and to identify locally driven solutions. So here on the picture, here on the bottom picture, we have Babu Sinappa, who's another student recipient. He's a student from India who's based in South India and studying at the National Institute of Open Schooling. And what he did is he began this running program for children with HIV and also worked to design food systems and nutrition programs. He twinned with another student who I think is presenting today, Sannigrahi. So they both worked together with the local homes and developed mentorship programs and with the local NGOs to think of ways to sustain these interventions for these vulnerable children even after they left as students. So that's what I want to describe the programs in a nutshell. But I also want to add that even though these programs are very practice-oriented, scholarship is also critical. And so in this short space of time, we made sure that each student who went through these programs, at least under the mentorship that I just talked about, each of them have publications under their belts. And their selected papers are listed here. So both students and the community from India are represented as co-authors. So overall, I just want to say that through this award, students are contributing meaningful public health work. But they're not just doing that, they're also returning with tools and perspective to shape a more just and inclusive and sustainable future for global health. And that's why I want to thank you especially for supporting this program. Thank you. Over to you, Beth.
Thank you. Very gratifying.
Thank you so much, Dr. Anita. I mean, hearing from all of you and just the holistic model that, has been, I would say, facilitated and grown over the years. I mean, I think that's really, really, I would say, encouraging at a time right now when we feel a little bit unsure, about the future sustainability of these types of projects and programs. And so very excited to be able to transition now to see some of the students' work, sort of come to life. I know that we have 2 students here that are continuing on in the work as an example of how these programs can be sustained. So without further ado, we'll hand it over to the students to share their screens, and I will stop and transition over to them.
All right.
Siddha, you're up first if you're available to share. Awesome. Perfect. Thank you.
Should be able to. All right.
Good to go.
All right. Hi, everyone. This is a great follow-up of Dr. Anita's presentation, but I'm going to be talking about my placement, which was focused on building youth leadership and resilience through a community-based participatory evaluation of the I'mPossible Fellowship, which I will go into in a minute. So my name is just a little bit of an introduction. My name is Sannigrahi. I was a Global Health Established Field Placement recipient in 2022, and then a Student of Travel Award recipient in 2023. I graduated from the School of Public Health in 2023 as well in international health, and previously also obtained a bachelor's in public health at UT Austin. So I'm just going to dive right into our program. So I had the pleasure of working on the I'mPossible Fellowship, which is a peer-led mentorship program for adolescents and young people living with or affected by HIV. And this is really a mentorship program that links one fellow with 25 peers, and they are trained to support their peers on health, mental well-being, education, leadership, among many other things. And so part of my project was to facilitate this knowledge base that the fellows had, as well as help with the implementation and evaluation of this program in its fairly early stages. And so since between 2021 and 2023, we had 216 participants enrolled, and then now in 2025, we have an additional 240, which is super exciting. And we've also primarily worked within the 2 southern Indian states of Karnataka and Tamil Nadu. This photo right here is the inauguration of our 3rd batch of fellows that occurred in 2023. I might be mistaken, but it continues to grow and evolve as I've been a part of the program. Also, like Dr. Anita mentioned, we have the Positive Running Program, which was really envisioned and guided by Babu Sinappa, who was also in my cohort of recipients who I work with very closely. And this program promotes physical and health among children and youth living with HIV as well, specifically through running, strength training, and nutrition support. So the goal being to build endurance, confidence, and life skills as well. And so primarily, what we've done with this program is we've introduced camps, we have dedicated training schedules and opportunities for children to go and run in major events across India. So we've had great success with this as well. We are currently active in Karnataka and Tamil Nadu, and more recently have expanded to more districts in Tamil Nadu, which has been really exciting in the last year. Babu was actually a recipient of the IAS, the International AIDS Society Youth Hub Grant to expand this project. So a little bit about my kind of placement roles and responsibilities. I kind of had a lot of hats as I was in my placement. My overall project, as I mentioned earlier, was building a community-based participatory research and evaluation framework for the I'mPossible Fellowship. And these kind of centered on themes of resilience, mental health, and health access. And so the project itself involved co-developing research tools, training fellows in qualitative methods, and then also collaboratively evaluating the fellowship's impact on peer mentorship, psychosocial well-being, and other community health outcomes. And my key roles and responsibilities centered around these 4 key areas, which was research, training, teaching, and institutional support. So primarily, I was there to support the work of fellows who are remarkably resilient and dedicated young individuals who have lived experience with HIV, who have really stepped up to show support for others in their community. And my major goal was to equip them with the knowledge in health, education, livelihood, and gender-related topics so that they could better support their peers when they were conducting those one-on-one meetings with them or support group meetings. And additionally, something that emerged organically while I was there was this idea of integrating them within the qualitative research framework. And so I trained them in focus group discussions and how to conduct individual in-depth interviews, among other things as well, making sure that our work while we were there was truly grounded in youth-led, community-based participatory research from design to dissemination. And so that was how we assessed the whole program. In addition to that, I had 2 other roles, which was teaching. So students that were at my home placement institution, Sannigrahi, which is a childcare institution for youth living with HIV between the ages of 13 to 18. I taught pretty I guess, standard subjects like environmental health, English, maths, among other things, to 10th and 12th grade students who Dr. Anita mentioned operate under a open schooling process, which is essentially kind of like homeschooling, where they're taught in the institution and then give exams, but don't necessarily have teachers in institutions. So I kind of helped fill that role, as well as vocational training programs that were occurring as well as institutional support to my home institution of Sannigrahi. So a lot of different things I got exposure to while I was there, which was absolutely incredible. And so if I were to sum all of these experiences up into one kind of idea or theme, it would be positive youth development, building on these 5 major attributes. One being competence, building knowledge and practical skills. Second being confidence, the development of self-worth and belief in one's abilities. Connection, building positive bonds with others and institutions. Character, acting with integrity, responsibility, and respect, as well as compassion, showing empathy and commitment to others' well-being. And these 5 C's, as we call it, of positive youth development, emerged really organically, like I have mentioned earlier. And these fellows who I worked with demonstrated all 5 of these characteristics exceptionally well. And it was increasingly known while I was doing my evaluation with them, how much so that they had grown within the process, how much dedication that they had to support their communities. One of the quotes that sticks with me the most is one of the fellows saying in their interview with me, saying that I can be a motivation to all these students. And what I had gathered from other institution heads and stakeholders from at that point was that this was a really major shift in this belief and this idea that they could do more to support their community. So these are all photos from wonderful events that have taken place while I was there. As well as some initiatives that fellows have taken. This top photo right here indicating kind of like the research aspect, support group meetings, education, and also learning how to present in front of other people as well. So really just overall, if there's one thing I would take from this presentation is this development of youth within this context. And so—
Very impressive, Siddha. Keep going, please. Yeah.
Okay. one of the things I'd also really like to highlight is the opportunity that I got to go all over Karnataka and Tamil Nadu and work with a lot of different types of community-based partners. This included childcare homes, religious groups, non-governmental organizations, and this exposure happened really early on, like within the first 2 weeks that I was there. And this really helped deepen my understanding of community-based care and strengthen my ability to collaborate across sectors to support the youth better by actually talking to those who have been doing this for decades. And so all these community partners were extremely welcoming and open about their experiences and really made me feel at home wherever I went, which was just something that will stick with me, I think, forever. And then all of this culminated into some of these very meaningful outcomes, so which includes first author publications, one from last year and then one hopefully this year that we'll be going through. I was able to present at the International AIDS Society conference last year in Munich, Germany. And most importantly, this grant was instrumental in bridging that gap between me being a student and me becoming a research associate. So I'm extremely appreciative that I'm allowed to keep collaborating with my youth and colleagues in India. Some of them pictured here from one of our data collection activities. So it really helped my growth as a researcher to be a part of this program. And lastly, I would be very remiss not to give a special shout out to my faculty mentor, Dr. Anita Sheth, for her continued guidance and inspiring vision for these projects. And I'm also very deeply grateful to the Institute for supporting students like myself. These are pictures of former students, and also future students who will be going to India for these placements. And one of the things that always when we ask for feedback about what was the thing that you liked the most about, or what did you feel the most after your experience, the one phrase that always comes up is life-changing. So thank you so much for all the support, and I'm so happy to be able to continue this work in the future.
Amazing. Thank you
Thank
so
you so
much.
much.
That was
Siddharth.
fantastic. I know that there's so much to ask and say about that. It just would blow me away to kind of just see it all come to life. But we want to save some questions for the end. So please mark those down. We want to have another student presenter talk about her experience. Divya, I think you're up next, or is it Manvi? Manvi, I think. All right. Manvi, you're going to share your experience next. Get your slides up. And all right, you're ready to go. Thank you.
Thank you, Beth. Good afternoon, everyone. My name is Manvi, and I'll be sharing a little bit about the work that I did as a student travel awardee back in 2023 and 2024 when I was a master's student with the Department of International Health at the School of Public Health. And this study really looked at using implementation sciences, formative research, and qualitative research to co-create an intervention that integrates mental health with tuberculosis services in India. And just a little bit of context about where the study was coming from and why we were doing this research. As we all know, India has a high burden of tuberculosis, and there's also a high burden of mental health conditions where there is a gap in terms of qualified mental health providers in the country. And there's a lot of literature around people who have TB that are at an elevated risk of being affected by mental health conditions such as depression and anxiety. And integrating that care model has the potential to improve outcomes for both conditions. And really a co-design approach where we worked with people who have lived experience offers sustainability and acceptability of the integrated care model and the intervention that we would then develop. So as a part of this work, we conducted in-depth interviews with TB survivors who had lived experience of mental health conditions, their family members, mental health providers, and tuberculosis providers. And this was sort of a formative study that was nested within a larger trial called the TB Aftermath Study. So it was great to sort of work with people who were working on an ongoing trial and embed myself within that atmosphere in Pune at the study site. And yeah, as we conducted these interviews, and what we found was that there was a lot of familial acceptance and relationships played an important role in terms of treatment journeys, and that stigma was really a barrier for people when they sought TB and mental health care. And families really played a pivotal role in whether or not patients sought treatment for mental health conditions. And this came out with our interviews with not only just TB survivors, but also their family members. Another prominent sort of theme that participants and TB survivors really described was that they experienced gaps in terms of seeking mental health care. And because most of our interviews were conducted in Pune, they were describing their experiences in terms of getting to mental health centers around the city, or their lack of awareness of, where these centers are even located within the system. And, the main sentiment really was that most survivors thought that the only way to alleviate their mental health conditions was taking or consuming medications or taking pills, and not really looking at as a holistic sort of treatment approach to both these conditions. And well, then finally, we also spoke to them about their suggestions on what they think this integrated care model should look like in terms of TB and mental health. And this was really the main aim of these interviews, and it was really exciting to talk to participants and hear what they had to say in terms of what they think they need in terms of their tuberculosis and mental health sort of needs. And a couple of major ideas and themes that came up was, they wanted more awareness about mental health conditions and existing mental health services that are available. And they wanted this sort of to be shared with their current TB providers, so that even the TB providers are able to share that those sort of resources with them. And that they also believe that, regular screening and counseling for TB patients at the time of TB diagnosis with regular follow-ups after that was really important, and was a sentiment highlighted by both providers and patients alike. And this sort of came out in most of our interviews, where they also believe that, sort of having TB survivors who've gone through the entire TB cascade come back and speak to existing patients or current patients about their experiences with navigating sort of their mental health journeys and their TB treatment, because, to form this peer-led group support sort of ecosystem for TB survivors, so that they're able to sort of fall back into a community setting to alleviate and manage their conditions. And what I did was sort of consolidate all of these data after analyzing them into into patient journey maps. And these journey maps really exemplify some of the participant experiences in navigating their mental health conditions while they had TB. I created different personas for males and females, because we found that the barriers and experiences that they had were very distinct from one another. For example, in the female's case, she feared TB recurrence and the implications of that on her marital life, specifically her relationship with her in-laws, who were not very supportive of her TB diagnosis and treatment. In the male's case, he consumed alcohol to manage his depression and anxiety. He didn't believe any form of sort of mental health intervention would alleviate his condition. He thought the only way to alleviate his mental health conditions was really to get a cure from TB disease. So as as a next step in this work, we presented these journey maps and findings from these interviews back to the participants in that community to really understand what those implementation strategies should be in terms of implementing this peer-led model for TB and mental health integration. And throughout the 6 or 8 months that I worked on this project, it was a great experience to conduct some of these interviews at tuberculosis units in Pune, collaborate with the TB aftermath study team at their study offices with existing members, of the team, and also traveled to various sort of mental health treatment centers where we conducted some of these interviews with mental health providers. And it was sort of it was a great learning experience for me, especially when we went to mental health centers, because we while going there, you realize how cut off it is from the rest of the city. This was the mental health center in this picture here was about a 20-minute drive from Pune city, and the only way to get there was using a cab. And while we expect, and it was sort of it was disheartening to see that, you know, patients were expected to go to these centers for their treatment, but they had no access to go there. So while we talk about these interventions on paper and really think about, you know, the numbers that there are X number of mental health treatment services in the city, you know, in terms of access and, you know, the real challenges that people face was something that, you know, I was able to see because of traveling to these locations and really talking with providers working out of these offices. So that was a great experience. And yeah, as I was able to present most of this work at the Union Conference of Lung Health in Indonesia last year. And I also had the opportunity to present some of this work at the Global Mental Health Research Without Borders Conference in NIH, which are pictured here. Yeah, that was a quick short presentation, and I'd like to thank all the faculty members who worked on this project and guided me through it, along with the study members and the TB Aftermath study team in Pune. Thank you.
Thank you.
Thank you.
That's fantastic, and it's
Thank you,
it's
Himangi.
an example of why you know, bringing that theory to practice is you know, really getting on the ground and seeing it and being immersed in the experience itself and seeing the barriers and trying to come up with realistic interventions. So thank you for sharing that perspective. Divya, would you like to go next?
Okay. So my name is Divya. I just graduated from the Department of Epidemiology at Hopkins, and my placement was in Nepal with the Zero TB Kids and Family Initiative. So, okay. So just as like a quick overview of what my tasks were in this project, I worked with two different NGOs, the Himalayan Trust Nepal, and then the Nepal Fertility Care Center, both in Kathmandu, Nepal. And this was within the Zero TB Kids and Family Initiative, which is an initiative across South Asia that works on TB screening, diagnosis, and treatment for both latent and active TB. And it has had a lot of success in reducing TB incidence in particularly in Tibetan refugee children in India in the past. And so I was assisting with screening children in rural Kathmandu and then also in urban areas in schools. And I was managing data across several screenings and also working on data analysis and supporting the monitoring and evaluation. So the main deliverable of my work was an analytical report that synthesized the field observations as well as the past screening data to make programmatic recommendations to improve the detection and measurement of TB in pediatric populations and underserved communities in Nepal. And so I just wanted to cover the main lessons that I learned from this experience. So first, I think in Nepal, I really saw what it means for healthcare to be community-centered. These weren't just like abstract concepts from the classroom anymore. This was care delivered through deep social ties and mutual responsibility. And so one example was observing female healthcare workers in Kathmandu, and they weren't just providers. They were, you know, trusted neighbors, they were cultural translators, and they were public health educators, kind of all in one. They promoted family health planning, maternal child care, and kind of helped the community engage with these larger formal health systems in ways that felt more comfortable and accessible. And so watching them operate as sort of links between households and health systems taught me that, relationships, not just policies, are what makes public health practice really work. So continuing with learning about community-rooted care, I just wanted to share a story. It's not just about delivering services, it's also about meeting people where they are, often literally. One day we were kind of in the rural hills of Kathmandu, and our taxi driver just didn't he didn't show up, and our ride kind of fell through, and we hiked across the hills to a monastery with backpacks full of TB latent TB pills, and our screening kits in like our kurtas and flip-flops, and we were bringing care to the people. It hit me that this is what public care to people often reshaped my sense of responsibility in as a public health practitioner. So another lesson was sort of how I had to kind of rethink traditional contextual factors that usually underlie public health problems in my academic and professional experience in the US. And so my training has been, centered around structural racism and broken institutions kind of causing poor health. But this doesn't directly, immediately translate. The frameworks don't sort of directly fit in the context of Nepal. Instead, I had to sort of confront these new realities that were maybe familiar in my personal history, but never relevant in my academic and professional one. Caste systems, religious dynamics, and global hierarchies and things like this. And so I had to sort of adapt everything I knew to a different context. And, concepts like decolonizing global health and tools like the socio-ecological model become sort of really messy and difficult in the field. And so it was both like humbling, but also just exciting to have to rethink everything about how I understand these upstream factors. So one of the things that shocked me the most in this experience was understanding how deeply latent TB and TB in general is neglected, and not just by communities, but by institutions. And so speaking with the clinicians that I was working alongside, there seems to be this massive gap in prevention. NGOs, medical professionals, and the government don't seem to treat latent TB with the urgency that it needs. This was also supported by my direct observations of adults that were being diagnosed with TB in front of me, who weren't able to sort of grasp the weight of the diagnosis. And I also saw, leadership of monasteries unknowingly or maybe knowingly sort of amplify the risks of TB through overcrowding or nutrition, for example. And so watching these decisions kind of be made in real time directly against public health recommendations that we were providing, they exist on top of cultural norms and traditions and misinformation. And that was really eye-opening for me. And so that sort of like glaring mismatch between lived experience and policy kind of just emphasized the need for like critically, like culturally attuned, realistic approaches to public health. And so just overall, I think my experience at the Himalayan Trust Nepal and NFCC both kind of helped me better understand the true burden of TB in pediatric populations. I also, I was able to service issues like mental health, the comorbidities that exist, and then the scale at which, treatment refusal happens. And so I think in the long term, I definitely see myself doing this sort of, global monitoring and evaluation work, especially in contexts that are affected by these larger factors of migration and conflict. And I think this project just confirmed that, field-based cross-disciplinary work is something that I'm really passionate about alongside local voices. And so I'm just really grateful to have had this experience. And I think that this placement shaped not only just what I want to study, but kind of who I want to be in this field as I go forward. So that's it. Thank you so much.
Well done, Divya. Very proud. Thank you.
Amazing. Amazing. That was beautiful, the way that you explained how it impacted you, as a person and a public health professional. No doubt that you'll take that forward and utilize what you learned and be more culturally responsive in anything that you contribute to in the future. So thank you for that. And then finally, we don't, it's like so much to talk about, but we have Jaylin to present as well about her experience in India as a GKI fellow, and Center for Global Health definitely recognize the support that they provide in helping us to match the placement sites to India that we support.
Yeah. Thanks, Beth, for that introduction. I'm going to jump right on in there because I know we are running a little bit behind. I first want to give an introduction. I am Jaylin Taylor. I am a recent graduate of the Bloomberg School of Public Health in the Department of Health Behavior and Society. So I completed my MSPH there in Health Education and Health Communication. A little bit about me, I am native to Louisiana, so I come from down south in Louisiana, and I originally came up north to go to Howard University in Washington, D.C., which you'll see me excited to have graduated there in 2023 in the picture in the middle. And then, like I said, I just graduated 1 week ago yesterday. And then I always love to include one of my favorite quotes from Maya Angelou. My mission in life is not merely to survive, but to thrive and to do so with some passion, some compassion, some humor, and some style. So I want to give you guys an overview of my journey. When I entered the Bloomberg School of Public Health in 2023, I like to say that international health was not necessarily on my mind. And I first heard about it through my program director in October of 2023 when we began talking about the different aspects of health education and health communication. And she kind of told us about the Global Health Established Field Placement Program. So I began looking at all of the opportunities there. And I found that a lot of the opportunities that I were interested in were in India. So I applied in January of 2024, was selected in March, and then I arrived in India June of 2024 and stayed through August. So while I was there, I supported the work of a new consortium called Seaworth, which is a consortium between the Bloomberg School of Public Health, the UP Department of Health and Family Welfare, and then AIMS Gorakhpur, which is one of the main medical schools there. So what we were trying to do, or what we were developing during that time, is an HDSS, or what is called a health and demographic surveillance system, which is really just a repository of information of people who live in certain catchment areas, is what we called them. So we had one rural area and one urban area, both in Gorakhpur, that we were seeking to kind of get information about the people there. So while we were there, our main goals were developing the HDSS and then also health system strengthening, which took me on a wild ride, which I'll be happy to share with you guys in some pictures on the next slide. But like I said, I was mainly in Gorakhpur, but our office stationary location was also in Lucknow. So I got to travel back and forth and see all the sites on those nice 5-hour road trips there and back. My faculty sponsor was Dr. Brian Wall, and we worked very closely with Raghukul Pandey in Lucknow. And what I did while I was there, since my specialty, if you will, is health education and communication, I really focused on developing things on the back end. So the standard operating procedures about how we collect the data, what will the data enumerators say to our clients that we're trying to get data from? How will we train them about ethics? What things can we take from my US context and put it in the context of India to help them really navigate those kinds of conversations? And I got to pilot the data collection tool with some of the faculty at AIM. So it was very interesting to get their professional opinions and kind of merge the two to create something that is usable today, which I'll talk about in a minute. So it was not all work and no play for me. I got to have a lot of fun. As you can see, probably the biggest pictures on these slides are about food because that is my love language. So I ate lots of gulab jamun. I fell in love with mangoes there. Butter chicken was my favorite. At one point, I ate so much butter chicken that I made myself sick. So not going to do that again, but it was great. But while I was there, of course, I was in UP, so I got to travel to see the Taj Mahal, which was amazing. In our health system strengthening efforts, we got to go to Labasna and train some IAS officers there about systems thinking using a game called Friday Night at the ER, which really helps the IAS officers work as a team to move people through assimilation of different departments in a hospital. Again, about systems thinking. I have this random picture here of this sign. I don't know if you can see my cursor, but it kind of says NOLA. And I always love to include that when I talk about my journey there, because being from Louisiana, one really well-known place that people know is New Orleans, Louisiana, and we shortened that as NOLA as well. So I got to see some Louisiana in India. That was a really nice treat for me there. Up here at the top, this is some of the team that I got to work with. I like to joke and say that on Friday, we always found reasons to buy chocolate cake. So if you look down at the table there, we have our Friday chocolate cake, which just happened to be the day that I left. Over here in the corner on the right-hand side is a picture of some of the beautiful scenery. I love trees and nature and things. But it's a picture of some of the beautiful scenery at one of the local health centers in one of the rural areas that we were working in to do the HDSS. We got to go there and talk to the leaders of the health center and pilot the tool there as well. And then on the bottom, again, you see me with chocolate cake. But this was my last night in the hotel that I stayed, and they really showered me there. I was actually their longest staying guest at the Saraka in Lucknow. So that's all the fun that I had there as well. What lessons did I learn? I learned that it wasn't about me coming in with answers, because we never really know the answers until we get our hands dirty a little bit. But it's more so about asking the questions. So my questions opened opportunity for discussion. My questions found loopholes. My questions helped us flesh things out a little more that made things even easier for them to begin data collection just recently. My questions helped us push our purpose a little further. My questions helped us talk to different people to get things done. So I learned that, like people always say, no question is a bad question, and there's always space to ask. In that same regard, there's always something to learn. Coming from the US, my context has always been US context. So coming into India, there are some things that I just wouldn't have known. So there's always room for me to learn. There's always room for me to grow. And even in that case, there was room for me to blend some of my US context into India and say, well, this is how I would do it here. How can we kind of adjust this to have a happy medium? And then, of course, communication and collaboration are key. In the office, we had lots of people working on lots of different things. And again, with those questions, I would walk by and say, this is what you're doing. How'd you get to this? And we were just able to make things better. That's kind of how I started going on the health system strengthening visits with them to Labasna and some of the other places as well. And then finally, I want to give you guys an update. So whenever I was there in India, we were doing a lot of the background work. We were applying for IRB. We were seeking government approval. We were beginning to develop those data collection tools. And they recently got approval from the government of India in March of 2025, and they started data collection earlier this month. So they've trained the data enumerators already. There are 15 data enumerators total, which is much more than we originally wanted, but they are working really hard over there and have already captured information from 10,000 people in one of the rural villages. So that has been a really high highlight for me to talk to Bragakul and Dr. Wall about where they are now. And this is actually a nice picture that they sent me the other day of the day that they finished wrapping up data collection in that village. And And that is all I have for you guys. Thank
I
you.
love the GKI social media. And that's the thing, honestly, you are a communication specialist because your journey in pictures just came to life. And I wanted to take a snapshot of your 3 tips because those are for anybody, anywhere, I think, in our lives. And I feel resonated with what you said, being in the US as the GKI based program manager, because we have an amazing team in India and we collaborate and we exchange, the India perspective, the US perspective, and putting it together is kind of brilliant to be able to, learn and connect and, really, make something bigger than any one of us could do on our own. So I just want to acknowledge also this group of leaders because we're continuing to expand our program. And this year we implemented a peer mentoring program where these great people have actually raised their hand again, and they're acting as peer mentors for the new cohort coming up because it can be very stressful getting to India and navigating these experiences. So thank you all for the presentations you did and also for being, leaders in that regard as well as mentors. So I'm happy to stay on longer if anybody has any comments or questions for Dr. Anita and the students, but really just want to thank everybody for attending and those that are watching this recording online as well for your interest.
Well said, Beth. Himangi, any comments or questions?
I wanted to congratulate all the recipients. Amazing work that you guys are all doing in India. Public health is very dear to me. I'm very passionate about it. And so just getting the perspective of the different types of projects that all these students have been engaged in and, the outcomes of all that has just been a very, very inspiring for me to be, getting all this information. So thank you so much and congratulations again.
Yeah, thank you, Beth, and the entire team. The truth be told, this is 3 years ago, all the project ideas were totally monopolized by Himangi. So because she's a healthcare professional, so these were all her proposals, suggestions. So, and it makes both of us incredibly gratified. We'll share with our family and friends. Divya and Siddha and Manvi and Jalen. Hopefully I didn't miss anybody. Very inspiring, your experiences. Jalen, my daddy lived in Baton Rouge. He went to LSU, so know a little bit about food in Louisiana. But all of you, incredibly inspired. Beth and Sarah and Kunal and the entire Johns Hopkins, Anita. Please pass it on to Amita Gupta as well. We are gratified. This is incredible work. The world gets better by a drop or two with the work that you're doing, right? So we look forward to being part of the Johns Hopkins community, not just because I'm an alumnus, but because of the good work you all are doing. So thank you for this opportunity.